I want to tell you something I'm genuinely proud of, and then I want to tell you why I will never use it. I went back to school. I earned a doctorate of medical science, so before anybody in the comments says I'm just jealous, I'm not. I've got the degree. And if you called me Dr. Patch right now, I'd probably grin a little. Dr. Patch. It's got a ring to it, right? But if you are my patient, if you're sitting on that exam table, scared, waiting to hear what's wrong with you, I will never, ever walk in and introduce myself to you as doctor. Here's why. I'm a PA, physician assistant, physician associate now, depending which week you catch us and which state you're standing in. And I love this job. The profession is growing up. We're earning doctorates, pushing for more recognition, more education. I'm part of that wave. My doctorate is real. It's earned. Nobody handed it to me. But it's an academic standing. That's what it is. Because here's the thing I can't get around. When a patient hears the word doctor, they don't hear has a doctorate. They hear physician. And I am not one. I have deep respect for the physicians I work beside. They did more years, more training, more brutal nights than I did, and I lean on them every single shift. We're a team. I'm not going to blur a line they earned. And I'm not some outlier grumbling in a corner about this. PA doctorate programs are booming, up about 200% since 2021. Most of them are less than 3 years old. The most common one is the Doctor of Medical Science, which is exactly where my degree sits. So this is the direction the whole profession is heading, and I walk that road myself. That's the point. I'm not judging anybody for getting the degree. I got the degree. But I will not call myself a doctor in front of a patient. I am that patient's PA, not their physician. So let me tell you about 2 moments that stuck with me. First one. I'm on shift, standing maybe 6 feet away, and I hear a fellow provider introduce himself to a patient. "Hi, I'm Dr. So-and-so." He wasn't a physician, he was a nurse practitioner. Different profession from mine, but the same advanced practice world I live in, and I just cringed. Not because he's a bad clinician. He might be excellent, but that patient now believes a physician just walked into the room, and that's not what happened. The second one hit closer. A friend of mine, somebody close to me, was telling me all about her doctor's visit. Her doctor said this, her doctor recommended that. And I happen to know the provider she saw. That provider is not a physician. She's a nurse practitioner with a doctorate, and she'd introduced herself as doctor. My friend walked out of that room genuinely believing she'd seen a physician. She had no idea. And I sat there thinking, this isn't just a thing I notice at work anymore. It's happening to people I care about. 2 moments, same nerve. And look, this isn't just me and my opinion either. In California, the law actually reserves doctor in a clinical setting for physicians. And in September 2025, a federal court backed that up, calling it misleading when a non-physician uses that title with patients. Not every state has drawn that line yet, but California drew it. And here's the part people skip right over. That rule doesn't only point next door at nursing. It points at me, at PAs, at anybody with a doctorate who isn't a physician. So even where the law's quiet, I hold myself to that exact same standard. Now, am I saying the title's worthless? Not even close. It is cool. When I'm teaching, when I'm a guest speaker, when I'm giving a presentation, Dr. Patch, absolutely. Slap it on the slide. That's academic. That's where it belongs. But in front of a scared patient, that's the one room where it stops being a résumé line and becomes a promise about who's there to help them, who's going to take care of them when they're scared. And honestly, let me pull the curtain back. When I earned my doctorate, you know what I got? No pay raise, no corner office, no extra prestige at work, nothing. I did it for me. Which is maybe exactly why I'm not going to wave it in the face of a patient who just wants to know who's taking care of them. Because that's what this really comes down to. A patient has one simple, fair question. Who is treating me? They deserve a straight answer. Not a technically true one, a straight one. Do I think doctorates will become the norm for PAs? Probably. You can already see it coming. We've got to stay competitive, but a doctorate is something you add after your name. It doesn't turn you into something you're not. So here it is. When you meet me, I am PA Patch. I am not Dr. Patch when I'm treating you. I am your PA. If this made you think twice about who's actually walked into your exam room, good. Ask the question next time. Nobody good will mind you asking. And if being called doctor in that room matters to you that badly, the door to medical school is right there. It's open. Go get it. I'll cheer you on.